Today, Governor Greg Abbott did announce that our state is expecting an initial shipment of more than 1.4 million doses. That's of the Pfizer vaccine alone. Our Brooke Katz is in studio tonight with a closer look at how hospitals are now preparing, since there's at least a bit of a number we know about.
Yeah, and Doug, I talked with the chief medical officer at Parkland. He says they have spent dozens of hours working out how to get their healthcare workers vaccinated.
Where it gets shipped to, who it gets shipped to, and then who we're allowed to give it to, those are all going to be actually dictated to us.
Dr. Joseph Chang with Parkland says his staff is ready to go as soon as they get the vaccine.
We will work in sort of a hub and spoke sort of structure where Central Parkland campus is going to be initially where we do a lot of this, and then we'll spread out from there.
The first priority will be healthcare workers. While side effects are expected to be minimal, Dr. Chang says the rollout will be staggered to avoid any potential issues with staffing. He expects the process will move fast once Pfizer's vaccine is given emergency use authorization.
My anticipation is that within a week after EUA is approved, that we would be already starting to give the vaccine. So that's a pretty quick turnaround, really, if you think about the logistics of this.
As for the public rollout, he says that will take more time. It won't be a situation where just anyone can request the vaccine.
It's not responsible for a society, for a commodity like this, to just say, hey, it's like Black Friday. Just come on up and get in line, and whoever gets their arm to me first gets the vaccine. That's not a way to do this, and that's not how it's going to be done.
But he says he does expect by summer or fall, at least one of the vaccines will be widely available in a drugstore near you. And just a quick note on the three vaccines by Pfizer, Moderna, and AstraZeneca. There are some differences between them, and that could affect where they are given out. So even if all of them were to get approval, it doesn't necessarily mean you would be able to pick your vaccine. Dr. Chang says he expects large healthcare facilities like Parkland will be given the Pfizer vaccine because it requires special ultra-cold storage. The other two don't require that, making them better suited for more rural areas and those smaller hospital systems. Doug?